Hi friends, welcome to the channel The Nurse. Here we are discussing about golden hours in emergencies. We will discuss MCQs related golden hours that is used in emergencies. Before moving to the topic, if you are not subscribed to our channel, please subscribe and please share with your friends also. So it will be helpful. We will discuss 20 MCQs here. First 10 MCQs we will discuss about the brief description about golden hours. What is golden hours? How it is important. After that 10 questions we will discuss about scenario based golden hour scenario based questions. So we will move to the topic. Uh, Golden hours nursing MCQs that is used in emergencies such as trauma, stroke, and myocardial infarctions. So it is very important in saving lives in emergencies. So we will move to the first question, that is, what is the golden hour in emergency medicine? The first 60 minutes after hospital admission, the first 60 minutes after a traumatic injury, the first 30 minutes after medication administration, the time of cardiac arrest. Here correct answer is the first 60 minutes after a traumatic injury. That may be traumatic injury, that may be any other emergency condition such as myocardial infarction or stroke. The golden hours refers crucial first hour following a traumatic injury during which prompt medical treatment significantly increases the chance of survival and reduces complications. So that is golden hour. The concept of golden hour emphasizes which of the following: delaying care until diagnostics are completed, rapid assessment and initiation of treatment, avoiding intervention to allow stabilization, immediate surgical operation in all cases. So here correct answer, that is rapid assessment and initiation of treatment, that is emphasizes golden hour. The golden hour concept stresses the importance of rapid diagnosis, resuscitation and transport to definitive care to improve patient outcome. So that is very important. That it included transportation also. Within 1 hour, patient has to receive emergency care. Third question: in a polytrauma patient, what is the most critical goal within the golden hour? Administering painkillers, preventing infection, stabilizing airway, breathing and circulation, that is ABC, providing psychological support. So here correct answer is stabilizing airway, breathing and circulations. So in the cases of polytrauma, they are following ABC criteria: airway, breathing and circulation. But in the case of cardiac arrest, they are American Heart Association recommends CAB format, that is circulation, airway, breathing. So first we need to assess circulation, then airway, then only last breathing. The ABCs are a top priority in emergency care. Maintaining oxygenation and circulation is vital for survival, especially within the golden hour. So in polytrauma cases, ABC is very top priority emergency care, maintaining oxygenation, circulation if it is needed, supported breathing also through ventilator or bag mask. Fourth question: which emergency condition also follows a similar concepts of golden hour due to time sensitive treatment? Migraine, stroke, appendicitis, constipation. Here correct answer is stroke. In a stroke care, the first 4.5 hours after symptoms onset is critical for administering thrombolytics, often referred to as golden window to prevent irreversible brain damage. So in a stroke case, the golden hours, that is first 4 hours to start the thrombolytic therapy. So that is in the cases of thrombotic stroke only. Hemorrhagic stroke, that is different. Fifth question, in myocardial infarction, what is the golden time frame to restore perfusion to minimize myocardial damage? Within 6 hours, within 90 minutes, within 12 hours, within 24 hours. So in the case of myocardial infarction, within 90 minutes is recommended to restore the perfusion. So otherwise, heart muscle get permanent damage. For ST elevation MI or STEMI, reperfusion therapy like PCI is most effective when performed within 90 minutes, often called door to balloon time. So in the cases of ST elevation, the reperfusion therapy should be done within 90 minutes. That is known as door to balloon time. This 19 minutes known as door to balloon time. There is another term. There is another term known as door to needle time. So can you define what is a door to needle time? You can comment it below. Otherwise, I can explain to you. Door to needle time, that refers to the time interval between a patient's arrival at the hospital, that is known as door, and the administration of thrombolytic therapy, that is known as needle. That is why it is known as door to needle time. So at the time of admission to the hospital to the at the time of the reperfusion or with the thrombolytic therapy, that is known as door to needle time. Typically in the cases of treatment of acute ischemic stroke or ST elevation myocardial infarction. So in the questions we have learned door to balloon time, that is 90 minutes, door to needle time, that you can comment. You can comment the door to needle time in comment section. Which of the following is a primary focus during the golden hour in trauma care? Detailed past medical history, administering antibiotics, controlling hemorrhage, checking insurance details. So, as you know, the correct answer is controlling hemorrhage is an important focus during the golden hour in polytrauma or trauma care. Uncontrolled bleeding is a major cause of preventable death in trauma cases. Quick hemorrhage control during the golden hour is a vital to survive. Then seventh question, the term golden hour first introduced by which of the following individual? Florence Nightingale, the R. Adams Cowley, William Osler, Clara Barton. The correct answer is Dr. R. Adams Cowley. Dr. R. Adams Cowley, a pioneer in trauma care, introduced the concept of the golden hour to emphasize the urgency of early trauma intervention. So here you have learned one more term, that is Dr. Adams Cowley introduced the golden hour to emphasize urgency of early trauma intervention. Then eighth question, a delay in treatment beyond the golden hour in trauma patients primarily increases the risk of muscle cramps, chronic pain, mortality and morbidity, obesity. Correct answer is mortality and morbidity. If delay in treatment, that will lead to mortality, death or morbidity, more complications. The chances of survival significantly decreases if appropriate care is delayed beyond the golden hour due to ongoing bleeding, hypoxia or shock. Next question. Which of the following best describes the pre-hospital priority in the golden hour? Extensive diagnostic tests, scene safety and rapid transport, waiting for family consent, delivering food and fluids. The pre-hospital priority includes the scene safety and rapid transport. So that is very very important. EMS personnel must ensure safety, provide basic life support, and transport the patient quickly to a trauma center within the golden hour. So scene safety also very very important. To otherwise the EMS emergency personnel also will have some accidents. 10th question. The goal of trauma systems during the golden hour is to transfer patient to the nearest clinic, maximize insurance reimbursement, minimize time to definitive care, promote bed rest. This is little bit confusing type question. So here correct answer is minimize time to definitive care. That is the goal of the trauma care system during the golden hour. So we will move to the trauma system are designed to provide timely and appropriate care within the golden hour to improve outcomes through rapid response and definitive treatment. So that is the goal of the golden hour or trauma system. 11th question. This is, from here onwards, we will discuss some scenario based questions to explain more about golden hour, importance of golden hour. 11th question. A 28-year-old male arrives via EMS after a high-speed motor vehicle collision. He is tachycardic, that is heart rate is 120, hypotensive, blood pressure 80 by 50, and has decreased breath sounds on the left. What is the priority intervention? Administer IV fluids rapidly, prepare for immediate chest tube insertion, perform a fast ultrasound, obtain a chest X-ray. So in this scenario also, the physician or the treating person will take decision. So they may vary some opinion. So here in my answer, that is perform for immediate chest tube insertion, because left side there is a minimal breath sound. So that may be due to some rib fracture or some hemorrhage in the lungs. So immediately we need to decompress the thoracic cavity. So sometimes the doctor will perform a fast ultrasound to recognize or locate the problem. So that may depends upon the treating person. So here my answer is prepare for immediate chest tube insertion. The patient's presentation suggests tension pneumothorax, hypotension, there is a hypotension, tachycardia, and absent breath sound in left side. So immediate decompression with a chest tube or needle thoracostomy is life-saving in that cases. Fluid are secondary and imaging delays treatment, that is fasting. Fast ultrasound also it is used as a part of emergency care during the trauma accident. During, and one more thing, you can comment what is fast in comment section. There is a full form for fast that you can comment in comment section. During mass casualty triage, which patient should be prioritized as red, that is immediate, using START protocol? Ambulatory with a leg fracture, unresponsive apneic after repositioning, respiratory rate 8 per minute, capillary refill more than 2 seconds, severe burns without airway compromise. So here correct answer is respiratory rate 8 minute per capillary refill more than 2 seconds. That may needs immediate care. Those that will categorized under red category. Ambulatory with a leg fracture, that may be that patient can wait for some time. So that can be categorized under yellow. Unresponsive apneic after repositioning, that may be there is a chance that may be categorized under black. So black means diseased patients. So that means the immediate treatment will not make a change in this case. So if there is a chance, it will convert into the category into red category. If the physician thinks there is no chance for survival, in that cases, this patient unresponsive apneic patient after repositioning categorized under black category. Severe burns without airway compromise also can be categorized under yellow category until unless there is a airway is involved. The START protocol prioritize respiratory failure, that is respiratory rate less than 10 per minute, and poor perfusion as immediate, that categorized under red. Unresponsive apneic cases categorized under black, while ambulatory patient will be categorized under green. Burns patient will be categorized until under a yellow category unless airway is involved. So here one question will arise: what is START? Full form of START. So START means simple triage and rapid treatment. Simple triage and rapid treatment. That is a full form of START. So this system is used in emergency situation to quickly assess and prioritize patients based on the severity of their injury. Usually, in under START protocol, it will categorize under four main category, that is immediate, delayed, minor, diseased. Immediate patient categorized under red, and delayed, the patient can be the patient treatment can be delayed for some time. That patients can categorized under yellow category. Minor cases will be categorized under green, and diseased patients or died patients will be categorized under black. 13th question. A 65-year-old female presents with sudden left-sided weakness and slurred speech, last known well 90 minutes ago. BP is 180 by 100. What is the next step? Administer aspirin 325 milligram. Lower blood pressure aggressively to less than 140 by 90. Prepare for altiplace if imaging excludes hemorrhage. Wait for neurology consult before treatment. So in this case, we can do prepare for altiplace if imaging excludes hemorrhage. So altiplies, it will make a thrombolytic therapy, so that will leads to increased perfusion in brain. So this scenario, the patient is within the 4.5 hours window for thrombolytics. In that case, BP must be less than 185 by 110 before altiplies, not aggressively lowered. Aspirin is given later and delays harm outcomes. So that is why altiplies is started. It is under the golden hour, golden window. So altiplies therapy can be done if imaging excludes hemorrhage. If hemorrhage is there, we cannot start altiplies because that will worsen the hemorrhage. 14th question. Which stroke mimic should be ruled out before thrombolysis? Bell's palsy, hypoglycemia, migraine with aura, seizure. So correct answer here, hypoglycemia. The symptoms of hypoglycemia may mimic like a stroke. So before starting the thrombolysis, we should exclude the chances of hypoglycemia. Hypoglycemia can mimic stroke. Example, hemiparesis may show, confusion will be there, so and is rapidly reversible. So always check glucose first, so that after that only we need to go for thrombolytic therapy and all. Bell's palsy affects only the face, while migraines and seizure have distinctive features. 15th question. A 55-year-old male has crushing chest pain, ST elevation in leads 2, 3 and AVF. What is the priority medication? Morphine, nitroglycerin, aspirin 325 chewed, metoprolol. So you need to understand what are the functions of this medicine, then you can easily answer here. So here correct answer is aspirin 325 mg can be chewed. So you should not you should not tell the patient to swallow. The aspirin should be chewed. That will make absorption faster. Aspirin inhibits platelet aggregation and reduces mortality. And nitroglycerin and morphine relieve symptoms but don't improve outcomes like aspirin. Beta blockers are secondary, that is for hypertension management, and so that can be used later. 16th question. A patient with STEMI, that is ST elevation myocardial infarction, develops ventricular fibrillation during transport. What is the first action? Administer amiodarone, defibrillate at 200 joule, start CPR for 2 minutes, intubate for airway protection. So ventricular fibrillation is the indication for defibrillation. So here we can give the correct answer, defibrillate at 200 joule. Unstable ventricular tachycardia and ventricular fibrillation are the indication for defibrillation. And immediately after defibrillation, we need to start CPR. Otherwise, patient's heart will stop functioning. Ventricular fibrillation is a shockable rhythm. Immediate defibrillation is critical. CPR follows if defibrillation fails. Even after defibrillation fails or after defibrillation, there should be CPR. Amiodarone is given after shock if needed. Which triage system uses color coding for mass casualties? APGAR, START, Glasgow Coma Scale, Modified Early Warning Score. So it is already discussed. Correct answer is START protocol. START or simple triage and rapid treatment uses red, yellow, green, black. These are the color code used in START protocols. APGAR is for neonates, GCS for assessing traumatic brain injury or conscious or neurological function, MUSE used for clinical to assess clinical deterioration. 18th question. In disaster preparedness, what does Hicks framework stand for? Hospital incident command system, hemorrhage control in critical situation, hypothermia intervention for cardiac arrest, hazard identification and control strategy. Correct answer is hospital incident command system. So what is hospital incident command system? That is Hicks standardizes roles. That is incident commander, logistics, etc. during the time of disaster. The other options are distractors for this question. So I will explain a bit more about Hicks. The Hospital Incident Command System is a standardized emergency management system used in hospital to effectively respond to and recover from disasters and emergencies. It provides a clear chain of command, assigns specific roles and responsibilities, and ensures coordinated actions across all departments. Hicks is flexible, scalable, and follows an whole hazard approach, helping hospital maintain patient care and safety during incidents like natural disasters, mass casualties, or internal emergencies. 19th question. During the golden hour of pediatric burn injury, the priority is to apply ointment, cover with ice, begin fluid resuscitation and prevent hypothermia, delay IV line. Here, the correct answer is begin fluid resuscitation and prevent hypothermia. That is especially for pediatric burn injury. Immediate fluid therapy and thermal protection can significantly affect outcomes in pediatric burn patients. 20th question. This is the final question. In neonatal resuscitation, what is the most crucial time to initiate life-saving interventions? Within 10 minutes of birth, within the first 30 minutes, within the first 60 minutes, within the first minutes. The correct answer is within the first minute, we should initiate life-saving intervention in the cases of neonates. The golden minute or the first minute refers to the first 60 seconds of life during which initial steps of resuscitation should be completed. So that is why Apgar score and all we are doing to assess the child's condition. So that is about today's video about golden hours in emergency. I think this is the first time somebody is discussing about golden hours MCQs. Also, you can share with your friends. So thank you for watching this video. Bye bye.